My name is Patience Afulani. I am an assistant professor in the Department of Epidemiology and Biostatistics here at UCSF. I also hold a secondary appointment in the Obstetrics, Gynecology, and Reproductive Sciences Department. And I do research on maternal and child health with a focus on understanding and addressing disparities in pregnancy and childbirth outcomes. The most exciting thing about my work here at UCSF is the opportunity to make a difference in the lives of women and children, particularly the most vulnerable women in different parts of the world. And it is also very exciting for me to have a job that gives you the opportunity to ask questions on issues that are relevant to people's healthcare experiences and take steps to find answers to those questions. So one of my primary areas of research is quality of care during pregnancy and childbirth. And I'm particularly interested in the person-centered dimensions of quality, which refers to whether care is respectful and responsive to people's needs, values, and preferences. And so it's been very interesting for me to start from a point of asking, how can we ensure that women's voices are included in measurement of quality of care, to actually developing a tool for this purpose, which we call the person-centered maternity care scale. And this scale is now being used in several countries around the world. We are in the process of adapting it to reflect the experiences of women of color here in California. And so it's very exciting to be at the forefront of this kind of work. Having this scholarship, it means a lot to me. It allows me to sort of advance my career in a way that is not usually possible with project-specific funding. And I feel very grateful for this opportunity. In addition, I think this kind of scholarship sort of validates the work I do. When you work in a place like UCSF with a lot of cutting edge research, sometimes you begin to feel invisible, and this Watson scholarships makes me feel like I am seen and my work is valued here at UCSF. And so my goals for this scholarship is to help advance my research in a number of areas. As I mentioned, one of the primary things I'm focused on doing now is adapting a scale we initially developed for low resource settings to reflect the experiences of women of color in California. So the plan is to be able to complete this work given this opportunity. I'm also doing some work on understanding the drivers of for person-centered care during pregnancy and childbirth in Kenya and in Ghana, and this funding will enable me to complete that work. But beyond that, as I said, it allows me to begin to think ahead. So one of the primary things I'm very interested in is beginning to develop interventions to improve person-centered care during pregnancy and childbirth, and particularly interventions that are responsive to the needs of vulnerable women. So my current research and that of others have shown that people's healthcare experiences depend a lot on their status, who they are, who they happen to know, or the connections they hold with key people, and where they go to for care. And so my long-term goal is to develop and test interventions to ensure that every woman, regardless of their status or connections, the type of facilities they go to, is able to receive care that is respectful and responsive to their needs. I've collaborated with a lot of people. I think UCSF has such a rich environment for collaboration, both within and outside of UCSF. And so I started at UCSF as a postdoc, and I had the opportunity to collaborate with several UCSF faculty and receive mentorship from several people, including Dr. Delis Walker here, Dominic Montego, Craig Cohen, Sandra Weiss, several people at UCSF, and I've also had opportunity to collaborate with people outside of UCSF in other countries. So my work in Kenya, Ghana has been through collaborations with colleagues in Kenya at the Kenya Medical Research Institute and also at the Navrongo Health Research Center in Ghana. And so I'm continuing to expand on these collaborations and beginning some new exciting collaborations with partners at Columbia University, at the University of Melbourne, and at WHO. It means a lot to me. I feel very grateful and honored to have received this scholarship. I feel it is validation for the work I do at UCSF, and that my presence at UCSF is recognized and valued by the institution. And so I feel very grateful and honored for it. And I'm really looking forward to the opportunities and the networking that comes with it. I mean, this scholarship. I think it is a great opportunity to extend my networks, my connections with others who are committed to improving the lives of vulnerable groups. And this is such a great opportunity to be able to do that. I feel very privileged to be here at UCSF. I came as a postdoc and I received excellent mentorship. I've had great colleagues here at UCSF that I really value the experience of being here. I did have other opportunities to explore elsewhere, and I decided I wanted to stay at UCSF because I feel it is a place that I can continue to grow and contribute to improving the lives of women and children around the world. And so I am very glad to be here.